and welcome to a great episode that we have this evening or day, wherever you are. And if this is your first time joining us, make sure you hit that like and subscribe button because you do not want to miss the latest content that we will be providing you. And for tonight's or this evening's episode, we have a special edition, and that is we are going to be highlighting some African Americans who have made some wonderful, and I mean wonderful, strides, whether it's in the nutrition, healthcare, wellness industry. We are going to be highlighting them. And at least for me, I always think of it from this perspective. I know we have Black History Month, but I feel like every month should be, or at least when it comes to history with African Americans, it should just be included in history, okay, regimen, versus it just being a month. Because at least for me, when I've looked and researched, so many people who've done many different things, it is still many more that a lot of people may not realize, aside from popular individuals such as Martin Luther King Jr., Malcolm X, um, Madam C.J. Walker. You have so many individuals who still or who have done wonderful things, but don't get the recognition. And so, at least that's just my take. Hopefully, one day it will be in history books. So, today I want to do my best, and I apologize in advance if you see me looking here and there because it is, again, just a lot of information. And I want to make sure that these individuals who put in this work, made these accomplishments, I want to make sure I get that right for you. So I'm sure you can understand that. So as we get started, again, I want to go through some names. Some people you may have heard of, but then some you may not. But at least for me, as again, I was reading, I just found it intriguing to learn about the stories and even to sometimes you have to think about what did a person have to go through in order to achieve some of the things that they did, even the mental, the emotional, just issues that they had to face. So let's get started with it. And so one of the first individuals that I wanted to talk about will be Dr. Daniel Hale Williams. Dr. Daniel Hale Williams. Okay. And so one of the things about Dr. Daniel Hale Williams is that he pretty much, I don't want to get this wrong, but I want to say that he pretty much was the first African American to perform a successful, okay, open heart surgery. Okay. And so one of the things about it was that there were other physicians. I think there was a physician by the name of um, Francisco Romero, and then Henry Dalton, who had previously performed uh, pericardial operations. And so the individual that he performed pericardial operation on, which the pericardium is the membranous sac that covers the heart, or it pretty much encloses the heart. And so there was an individual who was pretty much stabbed. And you have to keep in mind that Dr. Daniel Hale Williams did not have the modern technology that we do today. And he did not have a lot of the blood transfusion equipment to deal with. So I could, I can't even tell you what he was working with, but he pretty much made it happen. He was able to perform this open heart surgery successfully. And that is pretty much a hallmark when it comes to Daniel Hale Williams. Let's see. We want to get into some other things about Dr. Daniel Hale Williams because, that's a hallmark. But then we have to look at the things that led up to that. So he was an individual who pursued medicine as a career, an African American doctor, of course, and he opened Provident Hospital, which was the first medical staff to have an interracial staff. Okay. So just think about that. And this was in 1891. So before 1900s had started, he pretty much opened up an interracial hospital. Okay. And again, he was one of the first physicians, like I mentioned, to perform the first successful pericardial surgery as a African American. And so as we scroll down, there were some other things again that I wanted to highlight, and then we'll try to keep it moving. But at least I want to give you some insight in terms of what these people did, because this is awesome. So when we so as I look at it, again, one of the things about it was that, when it came to hospitals, I'm not sure what this region was, but it seems like it was in Providence, and it pretty much talked about how African American citizens, they were barred from, receiving health care at hospitals. And so you can imagine a person who was sick or had different types of medical issues, you are being denied access to hospitals, and as well as getting the proper care. So you have two issues right there. But then Daniel Hill Williams, he was like, you know what, we got to change this. And so he pretty much again opened up private den hospital, like we talked about, and a training school for nurses. And this became the nation's first hospital with a nursing and intern program, again, that had a racially integrated staff. So this is wonderful things on top of wonderful things, about Dr. Daniel Hill Williams. And another key piece before I move on, to me, I again thought that this was neat. In 1895, so this was about 4 years after he opened up Providence Hospital. So in 1895, he pretty much opened up as well as co-founded the National Medical Association. Now you had the American Medical Association, but some backstory about the American Medical Association was that it did not allow African American membership. So opening up the National, Medical Association, this allowed for African Americans to have membership. And this was also a professional organization, excuse me, for Black medical and practitioners. Okay. And so again, this served as an alternative because the AMA, the American Medical Association, wasn't allowing membership towards African Americans, but the NMA said, hey, come on over here. Ain't nobody gonna start this party. So that's pretty much a brief spiel about Dr. Daniel Hill Williams. Obviously, there's so much more, but those are just some of the highlights. Another person that I really wanted to highlight in, let's see. So yeah, Dr. Patricia E. Bath, Dr. Patricia E. Bath. And you'll start to notice a trend that most of these individuals were doctors, because you want to know what? They were really serious about getting the work done, and they saw a need, and they wanted to make sure that they were not, lacking when it came to fulfilling those needs, that they saw. So to me, I found that this is awesome. But Dr. Patricia E. Bath was an inventor, a laser scientist, an ophthalmologist, best known for her contributions to the blindness prevention, treatment, and cure. And so she also, one of the other things that she did was she also uh, had a great impact when it came to public health, and as well as having a patent for a device used for cataract surgery. And this was known as the laser phaco, or laser phaco, if I'm saying it correctly. But she was able to file and she was able to receive a medical patent for this device. Now, again, this was actually during, I'm not sure exactly when this was, but likely during the 50s to the 60s that she, or I should say, probably the 60s or 70s, that she did this work. But at least between 1969, 1970, interned at Harlem Hospital in 69. In 1970, she completed a fellowship for ophthalmology at Columbia University in 1970. Then she became the first resident in ophthalmology. Excuse me, I'm trying to make sure I pronounce that word correctly. This was from New York University. So she became the first resident there. Okay. So again, one of the things that she did was helping to bring, an awareness when it came to surgical devices in Harlem hospitals eye clinic. Okay. And get this, one thing that she did was she was able to persuade, okay, she was able to persuade her professors to provide free care for those who are blind. And that is speaking volumes. Okay. When you can persuade professors saying like, hey, like don't charge anybody for, any fee, like they really need this work. And like, we got to pay some bills. And to persuade individuals, that again is a, to me, a highlight, something that shouldn't be overlooked, because again, we have to understand again the conditions that a lot of these African American medical practitioners that they had to deal with. And so this is, to me, again, a highlight when it comes to Dr. Patricia E. Bath, laser scientist, inventor, and ophthalmologist. Okay, excuse me, I'm gonna mess that word up, but my apologies. So another person that we want to really highlight is going to be, and I'm just kind of throwing these out in random order, but it was actually, let me make sure. Okay, so this was actually Dr. Make sure I get the name right. Dr. Jane Cook Wright. Okay. So again, you start to see the trend. A lot of these are actually doctors, but Dr. Jane Cook Wright, she was pretty much the first Black American woman to be named associate dean of a medical school. Okay. And she pretty much contributed to essential findings as it relates to cancer, as well as created programs geared towards studying chronic diseases. So, Dr. Jane Cook Wright, she did some wonderful things, and we're going to get into more of what she did. Excuse me. And so, to me, I thought that this was pretty neat. So, just to give you some backstory, Dr. Wright became a visiting physician at Harlem Hospital, and seems like Harlem was a pretty busy place with, a lot of um, individuals who were going there and becoming physicians, or at least were physicians. She became a staff physician at New York City Public Schools after joining her father, who was the founder and director of the Cancer Research Foundation at Harlem Hospital. So you can see that Harlem was going, it was moving. It had, physicians who were ready to put in some work. And to be honest, if I was living, I would have wanted to be in that area because I know I was going to get taken care of. So, together with our father, Dr. Wright worked to advance research as relates to anti-cancer chemicals, and having achieved several patient cancer remission cases. And so after her father died, she became the director of the Cancer Research Foundation. Okay. Cancer Research Foundation. And then it says 3 years later, at the age of 36, she became an associate professor of surgical research at New York University and the cancer chemotherapy director at NYU Medical Center. Okay. So Dr. Wright, she was working, she was busy. She didn't have any time to play games. She was making some accomplishments, and you can hear that from, what I just shared with you. And let's see. Oh, and this is also neat. So in 1964, Dr. Wright was appointed by President Lyndon B. Johnson to the President's Commission on Heart Disease, Cancer, and Stroke. The commission was instrumental in establishing cancer centers for chronic diseases nationwide. Okay. So let that sink in. Okay. So again, this was instrumental in establishing centers for chronic diseases nationwide. Okay. So not local, okay, not isolated, but this is nationwide. Okay. And this is what Dr. Wright did. And so again, these are no small obstacles that these individuals accomplish. Listen, they set out some goals, and they say, you know what, we're going to accomplish these goals and we're going to keep going. And so again, most of these individuals, wonderful individuals that I mentioned, had doctorate degrees because they weren't satisfied with just getting a master's or just getting the base requirements. They wanted to really do some stuff. So this was Dr. Jane Cook Wright. All right, so we're doing pretty well on time. I want to probably do about two more individuals and then we'll wrap it up because, again, the list is so extensive when it comes to individuals who have made some strides. And I'm sure you can probably hear the excitement. And, I still get excited just learning about some of these individuals. So I hope that you can bear with me and I try to compose myself. But another one that I do not want to forget is Dr. Marilyn Hughes Gaston. Dr. Marilyn Hughes Gaston. Okay. So Dr. Marilyn Hughes Gaston, she is a pediatrician because she is still living. Okay. Born in 1939. And she was the first Black woman to direct a public health service beret. Okay. Beret. Now, this was groundbreaking because, a lot of their research, or they had groundbreaking research focused on sickle cell disease that resulted, just like Dr. Jane Cook Wright, nationwide. Okay. Nationwide. So when you hear that, that is big. But this resulted in nationwide screening programs for children at birth. So this is very important because a lot of kids can have different diseases and especially minorities, and not sure, at least, the parents are not sure of what the issue could be. But Dr. Marilyn Hughes Gaston said, you know what? We got goals, but we got to keep this work going. And so this, again, resulted in nationwide screening programs for children at birth. Um, let's learn more about Dr. Gaston. Let's see about Dr. Gaston. So she knew that she wanted to become a doctor. And I will tell you, at the age of 9, she witnessed her mother fainting. And, she or her family knew, what was going on. But also, Dr. Gaston, she had a struggle growing up. They were economically disadvantaged. When it came to health insurance, they were uninsured, nor did they get the proper care. And so this led a spark to Dr. Gaston, really wanting to do something differently, not only for her mom, obviously, but to really see others around her impacted. Also, during this time, it was learned that her mother had cervical cancer. So likely the fainting that Dr. Gaston saw her mom experience, after that, understanding, okay, what type of issues or conditions does she have, and so they were able to realize that her mother had cervical cancer. So that was at age 9. So at age 12, Gaston's family moved out of public housing because prior to that, even up to most of her childhood, they were living in public housing. Okay. And so this allowed her to attend a college preparatory school. So again, this is at age 12. Okay. At age 12, moved out of public housing. She started to attend a college preparatory school. And this is wonderful. And so again, I want to kind of highlight, okay, again, I kind of want to highlight the issues that a lot of these individuals, African Americans, face, such as racism, especially for women, sexism, okay, to pursue an advanced degree and to really be focused, but also to experience discrimination, to experience sexism, and then to experience racism. It was just a lot of, I would say that could be a lot mentally that you have to deal with, especially if it's every day you are having to experience certain comments. But again, they did not allow that to stop them because, in front of their first name, they have doctor. Okay. So they weren't going to let any, type of comments, cause them not to get what they needed. So let's keep it moving. So Dr. Gaston, she after she graduated high school, studied zoology at the University of Miami, okay, in Ohio. Not sure how that was possible. I don't think I ever heard of that. But anyway, so let's see. We want to keep it moving. So Dr. Gaston, get this, is was one of only six Black women who graduated from the University of Cincinnati School of Medicine in 1964 that year. So, okay, so she was only one of six Black women who graduated from the University Cincinnati Cincinnati School of Medicine in 1964. Okay, and so in so let's see. So she gained an interest in sickle cell disease after she interned at Philadelphia General Hospital. And, again, she worked with infants who, had issues at birth. And, one of the things that she also did was, or one of the things that we can appreciate is, again, how to screen and treat SCD, which is sickle cell disease. So, Dr. Gaston was continued to do some wonderful things, and I'm just going to get some brief highlights, move on to the last person, and we'll try to wrap this up. So she was able to secure some federal grants to study SED in children, published a groundbreaking study in 1986 that proved the effectiveness of long-term penicillin treatment to prevent infections in people with SCD. Okay. And so by 1987, 40 states had SED screening programs, a move that saved countless lives. So this didn't say 100 or 1,000, it said countless. Okay. And this was across 40 states that had the SED screening programs. So these are some highlights. 1990, Dr. Gaston, okay, Dr. Gaston became the first Black woman director of the Bureau of Primary Health Care in the U.S. Health Resources and Services Administration. Okay. In this position, she controlled a 5 billion, okay, not 5 million, but a $5 billion budget. Okay. And served over 12 million patients. Okay. And get this, whom were economically disadvantaged. Okay. So 12 million individuals who likely would have, or I probably would say a percentage of them would have likely struggled longer. Some may not have would have ever gotten the care, but they were economically disadvantaged and they were served. Now, again, this is just some highlights for what Dr. Gaston has done because, as far as I know, she still lives today. And so it because of her, wonderful service in 1999, she received the National Medical Association Scroll of Merit. Okay. And she also got a day in, she also has a day in her honor. So this is in Cincinnati and Lincoln Heights, Ohio. So she has a day named after her. She has a scroll of merit that was presented to her in 1999. And then there is a scholarship program from the University of Cincinnati College of Medicine, excuse me, that is established in her name. Okay. And this is geared towards those who are economically disadvantaged. So, Dr. Gaston has been putting in some work, still does, and is, wonderful just hearing about her. So the last person that I do want to highlight is a person that I actually had to do when I was in school when it came to presenting about this person's life, and that is George Washington Carver. George Washington Carver. Okay, so I couldn't remember if he was a doctor. It's been a while since I, really dove into, Mr. Carver, Dr. Carver, but Mr. Carver or Dr. Carver, I'm just going to say it until I figure it out. But he pretty much was instrumental when it came to understanding the well, I pretty much say that he was pretty much an agriculturalist, a scientist, a botanist. Okay, so he helped with herbs and providing different remedies when using certain herbs and plants. So many other things. I mean, he pretty much did a little bit of everything. Um, Early on in his childhood, I know he had whooping cough and he was small, frail little child. But whooping cough is pretty much when your voice is high pitched, and so just like I'm talking to you right now, it is like a more high pitch. So if I wanted to say something to you, that's how. So that's kind of how it would sound. And so because he had whooping cough, and again he was frail, he wasn't able to do a lot of field work. Okay, and so not being able to do a lot of field work, he stayed inside, and so his adopted, I want to say his adopted mom at the time, because I believe he was adopted, taught him pretty much how to just care for the home. So learned how to do laundry, learned how to cook, learned how to embroider. Okay, learned how to do a little bit of everything as it relates to the home. And so one of the things about Dr. Carver's Dr. Carver was that he wanted to really help. At an early age, he helped farmers, with their crops, and so they would call him the plant doctor because he would pretty much, take what he learned from, herbs, from just working with plants, and even making different remedies. He would take that and he would apply that to the upkeep when it came to crops. And one of the things that he is known for is being able to, again, utilize peanuts, sweet potatoes, as well as soybean, to enhance crops. Because at that time, he also discovered that the the years that cotton was grown, it pretty much depleted the soil. At least this was in the South, and so hold on, let's see. Uh-oh. Let's see. Get back. Okay. So anyway, so one of the things about Dr. Carver was that he learned again that cotton pretty much depleted the soil. And so peanuts, sweet potatoes, and soybeans, probably not the only products, but these are three of the common ones that were used to pretty much help to revitalize the soil. And that was one thing that he investigated, as well as taught farmers how to do, was that he pretty much gave them that use, when it came to peanuts. Because early on, farmers, he pretty much introduced them to, a lot of peanuts, or that they grew up peanuts, but then they found out, what can we do with all of these peanuts? He got in his lab. He was like, you know what, we're gonna figure out something. And I want to say, from the time that he was in his lab, this is later in his career, he discovered over, I want to say it was over 100 different uses, or peanuts and the sweet potatoes, including soaps, different different food formulations. It is just countless in terms of what he was able to do during that time span. I'm not sure if it was just one night or if it was a week or a month, but he pretty much, developed over 50 uses, at least that we are aware of. Um, just some other facts about it, and we'll wrap it up. So his last name, I didn't realize this, was that he adopted his, I want to say Washington, not last name, but Washington. He adopted it once he met with Booker T. Washington. So they both actually taught at what is known as Tuskegee University, which I believe that Booker T founded. And so one thing that I really didn't realize was that, you know, Carver and Washington, they actually, didn't always see eye to eye at times. Because, Carver, he wanted to be more hands-on when it came to science, and wanted to really have his inventor hat on most of the times. But in that role, he had to also teach. He had to serve as, the facilities coordinator, so, or pretty much upkeeping the facilities. And that was one thing he wasn't interested in. And so I think after Booker T. Washington died, he started to feel relieved, because he was able to get into the lab, and he was able to devote more time, for just science and inventing different uses of products. Because I want to say another, may have been an African American woman who was hired, who then started to teach the students. And so, again, that was just a little bit about his time at Tuskegee University. But again, it is so much when it comes to George Washington Carver, a lot of things that he did, as well as Booker T. Washington. Um, Another quick fact I want to point out was that, excuse me, was that George Washington Carver was the first African American to receive his bachelor's of science degree. Okay. Let me say that again. He was the first African American man to receive his bachelor's of science degree. Okay. Now that was something that I did not know about. But again, that, to me spoke, volumes in terms of, again, a lot of things that people had to experience. And, this is something when you think about what people had to do in order to get to where they were, as well as, to make the strides and to even make the accomplishments that they did. So again, this is just a snippet of, some of the African Americans who have made tremendous strides when it has come to health and wellness, as well as, those who, continue, because again, some of these individuals, they um, are living currently, and some have actually passed on, but I know that their family has taken on their legacy and continue to build on to that, as well as what they started continues to thrive. So again, this is some wonderful information. If you have a chance to explore African Americans who have made wonderful contributions as it relates to nutrition, health, food, and so many other related topics. So, hope that you enjoyed this segment. I hope that you find it quite interesting because, again, I know I did. So, if you did, make sure you give us a like, subscribe to our channel, that we can stay up to date with the latest content, as well as let us know how you thought about this episode. Because, again, this was one day we really wanted to switch it up. We wanted to make it more about those who have made some contributions, but don't get the spotlight or even get the highlights. And so we wanted to present that to you. And hopefully you found this informational, intriguing, and even leads you to saying, you know what, let me see about some other people that I may not know about. So if that excites you, make sure you hit that like and subscribe button because you do not want to miss some of the latest, and I mean latest content that we present to you. So if you enjoy that, again, hope that you like and subscribe to that. And until